Okay.
Plus, I don't know if then that triggers people to be let in. There was something about that.
Yeah, there was something about that.
Yep, there we go.
Good job. We would have just been sitting here like, doo-doo.
I listen.
Yeah.
Sometimes.
All right, I'm going to share this info screen for now. Where do you live now, Aaron?
I'm based in Providence, Rhode Island.
Okay.
So a little bit far away from Chicago, but I do miss it.
Yeah.
Same weather.
Yeah. Oh, look at that CLS care kit. Nice. Oh,
Got the
makes me so
MRI
happy.
machines and everything.
That's awesome.
And Aaron, these are going to be also recorded and put on demand for people who aren't able to attend during the live session.
Perfect. On demand COCA-I.
Yes.
Sorry, I'm still working. I'm gonna be working all day.
No problem, Beverly. Me too.
All right, I'm filling 200 gift wishes for kids for the holidays.
Oh, incredible. That's awesome. I'm so happy that you have one of those care kits.
Yeah, although, you know, I'm all about expanding it because I've been giving them to kids with sickle cell because we serve both populations, and I can't say, sorry, you can't have one, you got sickle cell.
Well, that'll be good news because we'll have, as of January, we have an expansion kit for sickle cell that you can put right on the box.
Oh, in January. So you send me emails and I respond to those emails, or somebody at Aflac Duck, but nobody answers the emails.
Oh, I represent kind of the company that works with Aflac to create the duck, but I believe there are going to be some folks on this call from Aflac who would be good to talk to. Oh, hey Buffy, there we go.
Okay.
Hi Beverly, how are you?
Trying to behave myself.
Beverly, you're saying you're emailing, but you're not getting a response?
Well, the email that you send to me, there's 2 different emails, it seems, when in regards to Aflac, and I forward it. So right next door to me, there's going to be a sickle cell office doing similar things to what we do. They're opening up next month, and I'm like, I got Aflac lined up for you.
Wonderful.
But we can't get any responses to our emails.
Really?
Correct. So we're probably emailing the wrong one, but it's the emails that you send to us. And
Okay.
it's not like it's not a no reply email. And it doesn't come back undelivered. So we don't know where they're going.
That's strange. I'll put my email in the chat so you have it, and that way you can email
Oh yes,
me
but I
direct.
don't save that chat. I'll need to get that down somewhere.
Or why don't you send me an email and then I'll have
will.
yours.
Correct. I sure will.
Okay.
All right. Okay.
Perfect. TCOB.
All right. Hang on. Where's that chat? Oh, great. All right. I'm going to send you a quick email.
Perfect.
I'm
Oh,
also
what if
having a
that's-
minor, just technical difficulty. I'm going to need to just drop off and hop back on really quickly. I apologize.
It's okay. Take your time.
I'll be with you in a sec. I've actually got things for you to do. Aflac. Aflac. What does Aflac stand for?
American Family Life Assurance Company.
What's the difference between assurance and insurance?
That's a great question. I think it's a marketing play, to be honest. So I think using the word
Oh.
assurance, it is insurance, but I think we use the word assurance so that you know we have you covered.
So I'm going to add this board member from the Sickle Cell Foundation. If I can find her.
Sounds great.
Maybe she's KM. Okay. Beverly email for Aflac. I told her I was joining the session today and I was get the answer. Here
Great.
is our solution. All right.
All right, so we're just going to get started so that way we stay on time today. And again, this video is going to be recorded so that way people who aren't able to make it to this live session can jump on and hear all this great information. So I want to welcome everybody. Good afternoon. This session is on My Special Aflac Duck, a companion for children with cancer and now sickle cell. Some normal housekeeping items that we have: make sure to rename yourself with your first name and camp or organization name. And please turn your video on so that way our presenter can interact with you, as well as keeping yourself muted unless the presenter says otherwise. There will be time for Q&A at the end of today's session, so please hold off on all questions until then. I now want to introduce you to today's presenter.
Aaron's not back on, Jen.
Oh no, he jumped back on. Where'd he go? I saw him when I started. Maybe it froze. So we'll pause and wait to introduce Aaron until he jumps
The
back on.
joys of a all virtual
Oh yes.
program. All the
Thank you,
technical
Mary, for pointing that
difficulties.
out,
Yeah, no problem. I didn't want you to
I
finish.
thought
and
he
then be
looked
like,
frozen, but I thought
"Aaron?"
maybe he was just sitting weird, you know?
Yeah. I don't see him at all.
Yeah, now I don't see him, but
Okay.
before.
I think he said he was going to jump off and then jump back on. So
Yeah.
hopefully he'll be joining us soon.
There he is.
There we go.
Yeah,
Hey.
I had started
co-host.
introductions, Aaron, but I think you were frozen there.
I was. Unfortunately, I had a technical difficulty and had to restart my
No
computer, but I should be
worries.
all set now.
All right, so now I'd like to introduce you to our presenter today, Aaron Horowitz. Aaron is the co-founder and CEO of Sproutel. The White House and former President Barack Obama recognized Sproutel as one of the 32 companies representing diversity in tech, and Aaron as one of the 50 honored makers. Aaron has spoken at Stanford, MedX, Digitas, Adweek, and TED at IBM, among others, where he explained how his experience with a rare childhood health challenge inspired his work making medical treatments easier for kids. He holds a degree in mechatronics and user interaction design from Northwestern University, a major that he created to pursue a passion for understanding how people play with robots. Aaron's superpower is that his passion is infectious. He gets people excited about doing well by doing good. Growing up with human growth hormone deficiency inspired his mission to create technology that puts patients at the center of their own healthcare. Aaron is a maker at heart. On a daily basis, you can catch him switching easily from building new business partnerships to carving foam prototypes. Joyful and effusive, Aaron is likely either carving stone or surfing when unplugged. We thank you so much, Aaron, for being here with us today. And now I'll pass over the virtual mic to you.
Oh man, thank you. What an intro. So let me just share my screen. I'm really excited to be here today and to share a little bit more about my special Aflac duck. I know that a lot of folks, or some folks in the audience, already know a little bit about my special Aflac duck. So hopefully this presentation just gives a little bit more of a cue in into what our design process was like creating the product itself, as some updates as to what's happened over the past year or two for my special Aflac duck. And lastly, some really awesome ways that we've been engaging with the COCA-I community and that we hope to continue to do so. So sharing my, one moment, share my computer audio. Here we go. And does everybody see this full screen?
Yep, you're good.
Wonderful. So hello, everybody. Great to see you all. As the intro said, I'm the co-founder of Sproutel. We work with some awesome partners to design, develop, and launch products that are all focused on improving health outcomes. We're a small and passionate group of people. This is our whole team on the East Coast and West Coast. We love working with partners. And so today I'm going to share a lot about our collaboration with Aflac to create my special Aflac duck. But just kind of to zero in on where our expertise is, it's creating really toys that are comfort objects for children. So our very first product over here on the left is Jerry the Bear, a teddy bear for kids with type 1 diabetes. And we created Jerry after seeing kids give injections to their stuffed animal. So this is really part and parcel to how we work and develop these products. So today, I'm going to focus on sharing, just kind of as I mentioned, what is the development story of my special Aflac duck, and then go into kind of how the product has evolved after we first launched, or after Aflac first launched it in 2018. So I just share this image because this image is really at the core of how we work. So we have this process, this patient-centered, empathy-driven design process, and it really starts from this methodology of that in order to design for people, we really need to design with people. And what designing with people means is listening. Because when we listen, we can truly understand their problems, develop a sense of empathy, and then from there, bridge out. And so the way that our process works is from this position of empathy, we immerse ourselves in the problem. We understand everything that we can about these individuals' lived experience. We ideate all sorts of potential solutions. And then lastly, we build, we test, and we iterate. So you'll see how all of this kind of comes into play in the creation of my special Aflac duck and in the continued kind of development of the program itself. So this process is roughly called the design thinking process. And this will be slightly academic, but the rest of the talk won't be. But this process is all about these units of diverging and converging. So when we immerse ourselves in the field, we listen to people's problems, we diverge, we learn all of this vast amount of information. And then we converge and we try to come to a unified set of insights. And we use those insights to once again diverge and come up with as many solutions as we can. And then we converge as we build, test, and iterate. So the story of developing my special Aflac duck is really rooted in an incredible commitment that Aflac has. So for the past 35 years, Aflac has donated over $150 million to pediatric cancer. And so our inquiry to create my special Aflac duck really began with saying, how might this philanthropy evolve and even more so directly engage families who are undergoing treatments? And so we sort of asked ourselves, how might we improve the lives of children with cancer? We knew from our work in Jerry the Bear that Aflac was really interested in adapting that and creating something similar for children with cancer. But our first phase was all about immersion. So, when we were doing our initial research, we learned all of these statistics, things like on your first day of treatment, you see 80 doctors, that the average length of treatment is over and up to 3 years for some children. These statistics that were really hard for us to understand and grasp. And so that's where we kind of dove into this immersion phase. And what that looked like was spending time with children, spending time with their parents, and just learning, really trying to understand what their lived experience was. And as we were kind of contextualizing this information, the way that we make sense of it all is visually. So we said, how could a family possibly see 80 doctors in their first day of treatment? And then we began to map out, well, well, what does a typical treatment look like? You're going into the pediatrician's office. They're seeing something, you're transferred to a hospital. And in creating some of these visualizations, we really began to understand the weight of what a diagnosis is for children, the weight of what a diagnosis is for their families and for their entire team of caregivers. We use tools like hear, see, feel, and think maps. This is a tool that as we conduct our interviews, we kind of distill out what we're learning into these different perspectives. So this one is a map for a child in particular. And, we learned and understood they were hearing child life explaining things. They were hearing words of support and encouragement. They were feeling anxiety, nervousness, the feeling of being overwhelmed, homesickness. They're seeing family members visiting. They're seeing their stressed parents. They're seeing their favorite toys. They're hearing, they're thinking, why me? I hate cancer. I'm bored. I don't want to do this, right? So tools like this, now reading this are at least for me, bring me right back to this research project and really ground the why, the why we need to create tools that provide comfort, that provide joy for these children. So we leveraged, whether it's hear, see, feel, think maps or mind maps, ultimately building up to kind of what is a map of emotional stress over the period of treatment for these families. Ultimately, it boiled down to this set of key insights. So this understand phase was all about taking a lot of information and kind of crystallizing it to saying, how can we make this actionable? How can we create something that truly benefits children and their families as they're going through this process? And so these 5 insights really powered the design of what we ended up creating. Loss of control. So cancer was taking families and children out of their typical routines. Children were losing control. They were gravitating towards play where they were in control. So things like Legos were requested by boys and girls because you get to build and control your world, right? So that was something really interesting for us, is how we could build that into every single aspect of the duck. The next was that every child is different and so is their treatment. And so unlike a lot of the work that we had done previously, cancer, the treatment is so specific to the child. And I know I'm preaching to the choir here in that you all know this already. But for us, this was really interesting to say, what are the commonalities? And what that kind of really started to boil down to are things like comfort and joy. The second, and dovetailing right off of that, are just that this process is so difficult for families that there were these, how might we deliver these moments of joy, these opportunities for joy in the day-to-day? Second to last, we saw some incredible existing techniques with child life professionals, with things like pet therapy, with guided breathing. And we said, okay, these practices are great. How can we empower families to practice them at home? How can we bring them out of the hospital? How can we bring them to places and other centers where there may not be child life, where there may not be these therapies? And lastly, for children specifically children who are inpatient, their days were just full of interruptions. And so we thought about how we can give children really privacy through this creation, through having their own environments. So as we went into the ideate phase, we basically came up with all of these different ideas. Something that I forgot to mention is that the first thing that we looked at is, were children using their stuffed animals, using their toys for play therapy? And they were. So the children with cancer we were interviewing were putting portacasts on their stuffed animals. And so there was already this incredible existing behavior that we felt we could build on and we could build around. So as we ideated, we came up with so many ideas and we started rapidly prototyping them. So we came up with every iteration. These we call thin slice prototypes. So the prototype dead center in the middle, this is one of my favorite prototypes. This is a duck. And the only thing the duck does is it purrs. It purrs like a cat. So we actually took a cat toy and hacked it apart and put it inside of this duck fur, because one idea was, hey, would it be comforting to have a duck that purrs? And we asked ourselves a question, would it be odd if a duck purrs? How would children feel about this? So we kind of hacked this together and we went out, we put it in the hands of children and we tested and we see their response. It turns out kids they kind of thought it was cool that the duck purred. It was kind of neat to have this a nice vibrating purring creature. So we would iterate these certain things. Some of them, like the prototype just to the left of that center prototype, is a duck with a little display kind of on its chest, right on its right side. That's something that didn't make it through. So we use this process of really both ideating, getting really broad, and then prototyping through some of these things. We do the same thing when we make some of our apps. So with the duck, we knew it was important not just to have a physical product, but to have something that children can also engage with. We saw how much apps were already being used, and so we thought about how we could enhance the types of interactions we were doing, the types of comfort we were able to provide through some type of a software medium. So here we ideated really broadly everything from, how might we do portacath prep and portacath access, to how might we have kind of rewards for children as they finish some of these things. And all of this kind of culminated through these really interesting testing sessions we would do. So some of our early prototypes, this duck to the left here, is just a stuffed animal. And inside that stuffed animal is a little Bluetooth speaker that we would pair to our smartphone. And so I'm kind of out of frame here. And whenever the child is doing something with the duck, I'm pressing a button on my phone to play that sound through the duck. So really finding ways of ideating broadly and then coming together to really test what resonates with families, what resonates with children, what resonates with their care teams, child life professionals, and all of the other people that surrounded them in a hospital setting. So all in all, this process took 12 months. We worked with over 100 families and 35 doctors. And I think you saw a lot of kind of the building, testing, and iterating in some of those last slides of how we kind of took some of our ideas and really sought to make sure that we were developing something that wasn't just cute and cuddly, but that we were developing something that really resonated with families. And I have just a kind of a short video clip that just kind of illustrates and shows this development process in action that I'll play here.
What if we could make a change
okay?
in the lives of children with cancer right now?
I was told that, I'm sorry, your daughter has cancer, and I was just in total shock.
Everything's really new in the beginning, and I have no idea what to expect.
Each year, more than 15,000 kids are diagnosed with cancer in the US, and the average length of treatment is 1,000 days. And so we thought about the need for emotional comfort for these children. And now we have the opportunity to bring the latest in social robotics into the field of medicine, bringing comfort and joy through this daunting process.
Oh, that's awesome.
What we try to do here is to give children the tools to understand what's going on and to empower them.
For our family and for Wyatt, the best use would be to help him communicate and a friend to comfort him when he's having treatment.
Play is natural to a child. Play is really how they learn and how they process.
So we leveraged play and some of the latest technology to create healthcare tools for kids with illness. Everybody knows the Aflac duck. We wanted to bring the Aflac duck to life into a caring companion for children with cancer. It responds and moves in a lifelike and natural way. They could feed their ducks, bathe their ducks, and when you tap these different cards to the duck's chest, it behaves with that feeling to help children communicate their feelings. By the time the duck is shipping, we will have spent 18 months designing, testing, and iterating with hundreds of families, doctors, and experts.
Hi, Levi.
What do you think the duck is doing?
Singing.
Duck is singing.
Yes. Quack, 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 quack.
First and foremost, the duck is a constant companion for children throughout their treatment journey.
He's kind of cute.
He's kind of cute.
Candy's going to do some breathing, and we're going to kind of match her breathing.
Just a
Tiny bit faster.
Perhaps most important of all, the ducks can share in the patient's experience.
Okay, actually, good job. Yeah, look at this. Pack is also getting one.
Can I try?
Yeah.
What?
I think it's so awesome. You just feel comfort, with something like that.
I really like the Aflac duck to be your friend, to help you get through all your tough times here.
I think the duck has the potential to have a huge impact on our patients, our families, and our healthcare program as a whole.
So technically y'all gonna make it happen to give everybody one or something?
That's the goal.
If she has something to sit with her, something that can take her through it. A friend that will always be there. And that would help a lot of kids.
So that video kind of coincided with when we launched the duck in 2018. And I'll share a little bit more about the outcomes and the things that we've seen since then. But just to kind of overview, what did we learn and how did it translate into what we ended up developing for the duck? So, going back to that central insight about control, every aspect of the duck is really designed to give children that feeling of control. So the first way that happens is through the duck's chemo port. You attach the chemo port right to the duck's chest, and children give their ducks chemo in the same way that they receive chemo. And that is kind of this built-in mirroring that extends through the rest of the product. It's something that builds on the insight of control and really serves to empower children. That's the ultimate goal here. The next way that cascades through is with the feeling cards. So we learned that it's so hard for children to express their emotions to their caregivers, kids as young as 3. And so we developed this kind of visual set of tokens that you can use to tap to the duck's chest for children to express themselves really through the duck. So a lot of doctors and nurses will ask how the duck is feeling and use that almost as a proxy to begin to learn about how the child is feeling. Lastly, one of the accessories that we launched the duck with is this soundscape spaceship, which you can tap to the duck's chest and play all sorts of really calming and natural environments. And this went back to that feeling of privacy. How can we give children privacy and control over their environment? So they can tap the soundscape spaceship, blast off into these other worlds, and then through the app, they can customize exactly what these worlds sound like. And over the years, we've added even more medical play into the duck. So you see some of these accessories around: a temporal thermometer, a syringe, a pulse oximeter, a self-adherent wrap, and a stethoscope. All tools that touch a child during their visits, they now get with their My Special Aflac duck so that they can go through all of these procedures with their duck. And so it really comes back down to mirroring, to having a companion that's going through all of the same things that the child is going through. And for me, I kind of shared this process of design thinking. It's a little bit abstract, but there's kind of one story of our development that catalyzes this, that brings it home. And what that is this. This card, this is the emoji that we use for calm. But something really interesting happened when we went into the hospital and tested for this. So the first thing that we did, how we arrived at this after learning that it was difficult to express that children express their emotions, we used that mind map tool to identify what are the most common emotions that children experience. And so we had a sheet of paper then, and it had happy, angry, afraid, and it had all of the words at the top. And then we went and we printed out on paper every emoji that exists in iOS and on Android. We printed out all of the emojis. We made it a card game for kids. So we had them match the emoji to the word. And here I am, I'm in my 30s. I'm like, okay, no problem. This is going to be really easy. But what I didn't realize is that young children, 3 and 4-year-olds, they don't know the word calm. So I'll just play a little bit of this video that was kind of a light bulb moment for us in the design of these cards. This is a little boy that we're just doing the matching exercise with.
Okay, what do you think means silly?
The bad guy.
This guy? Yeah. What do you think is mad?
I think this one.
This one?
This is the emoji I want to get.
This is your emoji? Okay.
Yeah, I want to get the angry one.
The angry one.
So something interesting happened when we asked this little boy about calm. He didn't know what the word meant. And so we described it. It's like being wrapped in your favorite blanket. It's like being in a bubble bath. Every single child who we explained calm to in these ways, like being wrapped in your blanket, they chose this face. And it might not seem like a lot. They chose this in this game. But here we've been able to use this kind of process of immersing ourselves with children, with the end users, And we've been able to give a voice to something that might not have otherwise been able to be articulated. Now there is a visual way for children to communicate about this. And that's what, for me, I know for Aflac, that is what is so empowering, is giving a voice to these children, is seeing them use this duck as a tool to communicate with those around them. And since we launched the duck in 2018, Aflac has donated over 12,000 ducks to children at over 300 hospitals and through 25 camps, which is so exciting. So thank you for everybody on this call. I know Beverly, you're here, you used the duck, and thank you so much. Oh my gosh. We've also gone on to do research on the ducks. We've been able to publish in Pediatric Blood and Cancer. And in just a preliminary feasibility study, we've been able to see that the duck, after a week-long stay in the hospital, reduces distress for children and their parents. It's something that we've all seen anecdotally, those who have used the duck. Having this on paper and having this published really brings kind of light to this more experiential thing that we've all seen, those of us who have seen the duck work. And we have so many families. So we're constantly going to this day and interviewing our users because we want to continuously learn. We want to learn about how the duck is being used. We want to improve the duck. And that is what we've done. So in 2020, or 2019 into 2020, we learned that actually we could improve the ways that we educated about the duck. So we interviewed 36 child life professionals, and we ended up creating this care kit, which is an educational toolkit for those that use My Special Aflac Duck. It consists of these medical tools. It consists of a really simple flip deck of cards that you can use to facilitate exercises like guided breathing, like meditation with children. It has this detailed instruction manual that is, we built in all of these cool features like, hey, when you use the COM card, after the duck takes 5 deep breaths, you pet underneath the duck's wing, it takes an additional 2 breaths, things like this, so that you can use the duck to puppet through these interactions. And that has been really effective at helping not just the duck get into the hands of children, but have the right kind of wrapping around it to make sure that it is used appropriately. And something kind of the next phase of iteration of My Special Aflac Duck that has been so exciting, it's what our whole team has been working on for this past year, has been developing My Special Aflac Duck for sickle cell. So this year, we actually went through that same process, that same immersion, understanding, ideating, building, testing, iterating. We worked with over 6 families and 7 children. These are some of our incredible heroes that we interviewed. I know that this is a community that is COCA-I, it's a cancer camping association, but I bring this up because I know that some camps serve multiple populations, and we're so thrilled to launch. It's gonna look like this. It attaches right to the side of the My Special Aflac Duck box currently, and it has a whole set of new accessories for children with sickle cell disease. And I'll just demonstrate here, one of my absolute favorite features is we're really interested in learning about how we can help give these families tools to use during a pain crisis to help children really be able to engage in distraction therapy in this difficult time. So we designed this, it's called the warming jacket, and it comes with this. This is a marker filled with water. And just using water on the warming jacket gives children a canvas that they can draw on. It all evaporates within about 30 seconds and you can draw again. And this is also meant to reinforce the importance of bundling up, because we know that rapid temperature changes can be really difficult and can trigger pain crises. So it actually has this super soft fur. So that is one of the features, and just really quickly, some of the others, because they really bring a new set of capabilities here. This is something that attaches right to the port-a-cath accessory, because many children with sickle cell, we know that they don't have a power port, but what this enables is it enables the port to clip onto the duck's wing like an IV, so that the duck can receive medication in the same ways that children do. There's a whole new family support guide that's focused on empowering parents. We learned how helpless it is as a parent when your child is undergoing a pain crisis. So we designed support materials around that. And lastly, our app has new features now, not just for children with sickle cell disease, but for all children. The duck has a home, and on the nightstand of the duck's home is a water bottle to focus on hydration, is a pill bottle. So you can give your duck hydroxyurea, a little warming bottle, and a whole art studio. And this is available for both children with cancer and children with sickle cell. In the art studio, it's going to be really fun. It's a creative outlet, just like we launched the Music Maker feature actually in 2020, where you can make music with your duck and your duck dances along. Now you can also make art with your duck. So the duck every year is growing. It's growing in the features. It's growing in the reach for families. And just as I wrap up here, I just want to recognize how powerful the COCA-I community has been for us, and just give a huge thank you to everybody on this call, to everybody that's already using the duck, and some people, if you're not, that I hope you may start using the duck after this presentation. These are just some of the photos that we've gotten in from families around the country who have received ducks through COCA-I. And I just wanted to share a story and give a little shout out to Camp Hobie in Utah through the COCA-I community. This was just something incredibly special. So last year during the pandemic was so challenging for so many individuals. And one of the things that we observed on the My Special Aflac Duck program side is that children are spending less time in the hospital. There's less time to introduce tools like My Special Aflac Duck in a hospital setting. But camps like Camp Hobie have really done something incredible. So during Halloween time last year, they set up this drive-through where they were able to, in a social distanced way and in a festive way, give out ducks. They gave out over 100 ducks to families in the Utah area, and enabled this impact, enabled this to continue to happen amidst a time that was so challenging. So this is just a huge thank you to all of the camps that are using the duck, that are distributing to families. And those that are not, please help us scale our impact. We're talking here, and we're here and are going to finish very briefly and have the rest of the time for Q&A and discussion, because we want to hear from the COCA-I community. We want to hear from camps. We want to learn about how you all are using the duck and how we can best meet your needs and hopefully get tools like this to children that really, really need them. Just one thing to recognize, because I realize I haven't said this yet, My Special Aflac Duck is absolutely free of charge to families, to camps, to whoever distributes them. It is Aflac's mission and the Aflac Childhood Cancer Foundation's mission to get this into the hands of as many children who need the duck as we can. So thank you all so much. Thank you for having me. I'm really keen to hear your questions. I have a duck here and I'm happy to demonstrate anything or just kind of get into a little bit of a discussion. So I'll stop sharing my screen here and we can hop on out.
Great, thank you so much, Aaron. I know there's no questions thus far in the chat. Does anybody have anything that they'd like to unmute themselves for?
I have a couple of questions. Well, actually, first of all, Aaron, actually, my son was on growth hormone for several years.
No way.
And his make-a-wish was to Legoland.
Me and your son, we get along.
Yes, if he was still alive. Does Aflac then fund all of these ducks? Like they have this like endless supply of money to fund these ducks? Like follow the money. That's my kind of MO in America.
So certainly not an endless supply of ducks, but Aflac has committed to providing ducks to whoever needs them. So we work with Aflac. We make a small amount of ducks every year, and we try to donate all of them. So far, we have not reached the limits of what is reasonable from a donation standpoint. And I know there are some folks on from Aflac on the call that certainly chime in, but you know, what I know is that they've been incredibly generous in wanting every child who desires to have a duck to have a duck.
Then I gave a duck to a kid and explained how it used, and the mother came back to me and said, "Oh, he recorded his heartbeat." And I was like, "Can that duck record heartbeats?"
So the duck cannot record a heartbeat, but the duck does play a heartbeat when the port-a-cath is attached. And I know if there's one thing I know about children, it's that they have incredible imaginations. So it could be possible that the child recorded their heartbeat and then played it by putting this on their duck.
All right. So then, you know, Tucson only is a city of about 1 million people. So there's only one treatment center here, clinic and inpatient, same social workers, child life, etc. So we serve all of hematology, oncology, except for hemophilia, because hemophilia seems to have their own big bucket of money to serve their families. And again, follow the money, you'll find out why. But so we serve all kids with different anemias and things, like there's all kinds of strange anemias out there. And, you know, they get chemotherapy and or, you know, many transfusions, etc. So to be honest, you know, when those kids are participating in our activities, events, we also provide the Aflac duck. So just full disclosure, you know, it's going to these, I mean, there's this, what's this? Oh, gray cell lymphoma, right? Who would have thought? I thought, oh, that must be named after Dr. Gray. No, it's gray cell because they really don't know what the hell kind of lymphoma it is, right? It's a gray area. So there's all kinds of funny diagnoses that get treated, you know. So I'm assuming that's fine with you and Aflac or whoever's paying for these things. Is that correct?
Yeah, I mean, we have the ducks available for cancer and blood disorder. So it sounds like a lot of those that you're listing fall into that category. So no problem with that.
Right. And so, of course, we've been giving them to families who have children with sickle cell, because again, we don't want to be like, sorry, people,
no,
you pass this table and go to another table. It's not
that's
for you.
right.
Absolutely.
So we're very excited to see. Now, you said they'll be available in January, because I have an event on December 11th. I would love them for.
They will be available in January. I mean, one thing that could be maybe helpful, I mean, I don't know, Aflac, if you would find this helpful, is maybe we could do I don't know if you're gauging interest from quantities that people might want to request, is kind of understanding a little bit about that could be helpful.
Yeah, currently we're not capturing quantities yet, but we are capturing interest. If you go to aflac.com/sickle cell, there's a place to actually sign up, and that way we'll alert you just as soon as those sickle cell accessories that Aaron went over are available. But for cancer patients, you can go to aflacchildhoodcancer.org now and order, register and order as many ducks as often as you need them, and they're free.
And so the only difference between the oncology Aflac duck and the sickle cell duck is this packet of goodies, like the box of goodies.
Exactly.
So we're going to do this event on, I mean, I'm feeling 200 gift wishes here, right? So, and let's say 50 of them are for children with sickle cell. In January, can I order just, well, so then can I order just that box to add
so
to
we'll ship them. We'll ship them separately, Beverly. And it's really cool. What we have is, this is a prototype, so it doesn't have it, but it has 2 pieces of double stick tape already on it. And we just ask that you stick it to the MSAD box, the My Special Aflac Duck box.
Oh, okay.
One of the reasons is that we learned in our interviews how heartbreaking it is when sickle cell families receive things that says cancer, because it just reinforces that there's not something just for them. So we intentionally made this that once you peel that double stick tape, there will be nothing in the instruction materials. There will be no word of cancer anywhere on the box for these families. It'll be distinctly theirs. And this will say, a special friend and companion for kids with sickle cell, and Aflac's promise that they're not alone.
So what's already in those boxes? I actually have an unopened box here, but you're saying there's nothing oncologically related in the boxes?
There's nothing that says cancer actually in the instruction manual. The only word of cancer is just right on the side of the box.
Okay.
Oh,
all right.
Oh, you have the CLS care kit. The CLS care kit has some mentions of cancer, but the boxes that go to My Special, that go to children, they only have that language on that one side of the box.
And that's where you want to stick that new box.
Exactly.
Got it. Yeah. I mean, I have this discussion all the time. People ask me, you know, sickle cell families, like, how come there's so much stuff out there for childhood cancer? And I'm very honest, to be honest. And of course, there's systemic problems related to this, historical problems, but you know, most childhood cancer organizations in my area were started or continued by people like myself who had a child with cancer and decided to continue the programs. So they're very parent driven. So it's a matter of, you know, taking the bull by the horns and whatever, you know, providing activities or taking on the system or whatever it is. But, you know, self-empowerment is a good portion of that in my observation. So yeah, I mean, I'm very honest with families, really. I don't mince words here in my observation. So that's why an office is going to open. It's actually the Sickle Cell Foundation of Arizona. It's going to serve Phoenix Children's Hospital as well as Tucson, but Tucson's, you know, mostly behind it. Yeah.
We have one question here from Kim. She is a child life specialist and is with Kids Cancer Care. She is wondering if there's any way to get these ducks to Canada.
So
Yeah. Go ahead, Aaron.
I was just going to say at this point, my special Aflac duck program is only in the US and Japan. Hopefully we may
Northern Ireland.
And Northern Ireland, I forget, I apologize. And so unfortunately not yet, but thank you for the interest and yeah.
Okay, thank you so much. These look amazing. And we work with a lot of kids out at camp as well. And we have like a clinic out at camp. So if and when these do become available, I think it'd be something that I would absolutely love to have out at our camps and when I do one-to-one sessions with kiddos. So if there's a way to be on like an email chain or anything like that, please let me know. And just know there's interest in Canada. So
thank you so much, Kim.
Yeah, thank you. They're amazing. I really, I think you've done a fabulous job, and yeah, and I would definitely use these in my practice often.
Thank you.
Well, and there is information in the chat for those who aren't following it on the Aflac childhoodcancer.org site where you can find additional information and a link where you can sign up, unfortunately, if you are in one of those areas that they currently ship to. But hopefully soon that will be expanding.
So is the reason it's not in Canada because Aflac doesn't exist in Canada, or?
That's part of it, yes. All the other locations, there are headquarters, Aflac headquarters in those areas.
Oh, is Aflac in New Zealand?
Mm-mm.
Because they have socialized medicine and other things that you don't need insurance for?
Well, they have socialized medicine in Japan, and that's our largest presence is in Japan.
Aflac.
Mm-hmm.
Oh, wow. So life insurance or something?
Supplemental.
Oh, supplemental. Huh. Mm-hmm. Well, yeah, they do have supplemental in New Zealand and Canada, but I mean, so they couldn't even make a US address close to the border and just whip them across the border. I mean, I spent a couple of years sailing around the world.
I mean, that's
so
very
I don't
creative.
recognize borders very well.
Yeah, we're not too far here in Calgary. We're not like too far. It's possible.
Would they be able to do that? Or it's like, oh, you're breaking too many rules here?
We would only know if they shipped in the US, so.
Oh, there you go, Canada. Shoot, I must have been raised a pirate. Oh my God. There's people out of the 70s, man. We don't recognize too many rules.
I love it.
Oh, heck. That's what 4 years of Catholic girls boarding school apparently produced. Oh, Lord. Okay, so I have another area of so as you know, siblings of children with cancer have a higher incidence of drug abuse and suicide as adults than the diagnosed child or anyone else in the family, including the parents. So, but siblings, actually, it's like a major multiplication when you add siblings to anything. So have you any thought to add siblings to this service and program?
Yes, Aaron can speak more to that, but he's actually presented a couple sibling related concepts. We haven't really gotten to delved too far into it, but we definitely have presented concepts around it.
Yeah, and it's something that we hope to do more in the future. I think that there are some people who have extended the duck out to siblings, and you know, we're aware that happens. I think, Beverly, like you bring up a great point. What made us so passionate about the area are exactly those reasons. I think particularly this tends to happen in cases of twins or in cases where the two siblings are very, very close in age. I mean, it sort of becomes almost a judgment call from the child life professional as to whether it's even appropriate to give it to one sibling without the other. And you know, it's not, though, it's something that's formal in the program that this goes out to siblings, but an area that we know a lot about and that we're interested in figuring out how we can evolve in a way that maintains the scalability and sustainability of the program for everyone, because that's kind of the goal, is to make sure that the program can exist sustainably and serve children with cancer and with sickle cell disease and blood disorders now for many, many years to come. And so the question mark of how we best serve siblings is something we know is critically important, and we don't yet know how to do that in a way that maintains the sustainability of the program itself.
Yeah, no, yeah. Okay. I think that's my extension of questions.
Do we have anybody else who has anything that they'd like to add or ask?
I just want to thank you so much, Beverly. It's the second time that we're meeting, and I always love how much you've engaged with the program, how much you use the duck. It is, I'll say for me, as you know, while we have worked with Aflac to create the duck, unfortunately, the vast majority of my day is not interacting with folks that use it. It's so rewarding to hear these questions. It's so rewarding to hear about the ways that you've given the duck out, and just thank you. Thank you for being such an advocate.
Yeah, no, the kids, it's really great that they can have something reflected in their own life experience. Yeah, which is very unique, right? Because everything is perfect in suburban America.
Wonderful. Well, thank you so much, Erin. This was definitely a treat to hear all about Aflac Duck, and to Buffy for helping answer our questions when it comes to the some of the logistical side of things. So yeah, feel free to stay on if you have anything else. If not, we will see you in future sessions.
Great. Thank you so much,
Bye,
everyone.
Thank you. This was great. Yeah, got all my questions answered.
Great.
All right.